you can start being the best first impression possible, that you can get patient compliance, that you can get the seriousness on their condition so the patients can get the care they need and get the results.
Hey, welcome back to AMC. I'm Dr. Miller. We're in a series on the value of internal protocols. Today we're going to cover the topic consult, exam, and report with Dr. Todd Osborne. Let's go ahead and get started.
I wanted to discuss consultation, exam, and reports with you today. The CER, as you may refer to it. But of all the procedures in your office, and I know it's important, the adjustments and the other things that you do in your office, but the consultation, exam, and reports are going to be the three most important procedures that you have in your chiropractic office. And of those, the consult is going to be the first, number one important, because you never get a second chance to make a first impression. And that consultation is your first impression with that patient. Now, the CER, it's where the stage is set for the lifetime of the patient. It's where patient compliance is established. And if you don't establish it here, you will never have patient compliance. And patient compliance is extremely important because without it, the patient cannot get the results that they should. So that affects the patient's health and it affects your reputation, because when they're non-compliant, they don't get the results and they're not saying the best things about you because supposedly it's your fault that they weren't compliant. And it can be your fault if you're not doing the proper consultation, examination, and reports in the beginning stages to establish that compliance. We're going to inform the patient the questions that they want answers to. They want to know, what's wrong with me? Can you fix it? And how much does it cost? And so your consultation, exam, and report should be set up to make sure that the patient is very informed on all of those questions that they have. Now, let's talk about the most important, which is consult. The consult should be 5 to 7 minute, very powerful, impactful time with that patient. You're making the first impression, as I said. You are getting their information and getting their clinical history, which is very important. And the other thing that you need to establish during consultation is starting a transition. The patient most likely is coming in with a pain problem, and they think it's just a pain. If I'm in pain, I've got a problem. If I'm out of pain, I don't have a problem. And so we need to start establishing with the patient and making that transition that this pain is actually a condition that's causing this pain, and that condition is actually causing them problems with their life, or could be causing problems with their life, whether it's work, their family life, just their overall recreation that they do, but it is affecting them much further than, hey, I've got a pain in my back or my neck. And the other thing that we have to do during consult is get them to agree to exam and x-ray without saying the words exam and x-ray. Because as soon as we say the words exam and x-ray, then the question pops up of how much is that going to cost, doc? And is that the place to be discussing it? No. We do not want to discuss money, especially in the consultation room. So we're going to avoid that, but we are going to get them to agree to examine x-ray, but we're not going to use that terminology. Now, we move them into the examination. Examination should be 7 to 10 minute basic chiropractic exam. This is not the time to do your full-blown orthopedic neurologic exam, because we are just trying to determine if they have a subluxation or not. So we're going to do our chiropractic exam. The chiropractic exam in 5 basic points can determine whether they have the indicators present of subluxation. And then if they have the indicators of subluxation, then that's cause for us to look at x-ray or other diagnostics that we might be using in our office. So we also, during the exam, begin to formulate with the patient the nervous system, how it's affected by subluxations, where those nerves go out to, and how that could be causing a myriad of problems that this patient has going on. And as I said before, this also establishes the need for x-ray, and we can transition that patient in to receiving the x-rays that they need in order for us to help them. Then we finally get to the report of findings. During the consult, we're the ear because we're listening to the patient. During the exam, we're the eye because we are examining, we're investigating what's wrong with the patient. And during the report, as chiropractors get to be that wonderful thing that we want is the mouth. And this is when we get to talk. And so the biggest thing that we see in report of findings problems is the doctors talk way too much. And they go on and on about the analysis, and really you have to simplify it for the patient. So keep it very simple and show them what's wrong, where the nerves are affected, and most importantly, we find that most chiropractors don't put the seriousness on it at this point in time. And so they try to make it lighter, and they don't like to tell the patient that they have a bad problem. No one likes to give bad news, and that's wrong because the patient doesn't actually figure out what's going on with them, how serious it is, and the need for the care to help them correct this, if at all possible. So we have to put seriousness on it. And a couple of ways that you do that is, number one, every report of findings, you should cover the past, the present, and the future. Okay, because their condition has a past, it's got a present, it's right now, and it does have a future as to whether they're going to receive care to help get it corrected, or if it's going to continue down the line it has to continue to get worse. And that's where the x-ray is so important in the report of findings, because we can show the patient the degenerative disc disease that's going on. And so that degeneration is a process like any other disease. It continues until it's stopped. And so we get to show the patient the seriousness of what they've got going on, what the future is going to look like if they don't get care, or if they do get care, what we can possibly do about it. We also always give a hope and proof factor to show pre and post x-rays of similar type patients or conditions so that they can see the type of results that they can possibly get in our office. And then the second report of findings is when we go into our recommendations with the patient. But we go through, we review what they told us, what we found, and what we told them during the report of findings, the R1, and then what we recommend to get their best results, the best care that they can possibly get into our office, and then also a financial report by your team members, your CAs in the office. So that's the CER in a nutshell. There's lots more to it, but I wanted to give you the basics so that you can start being the best first impression possible, that you can get patient compliance, that you can get the seriousness on their condition so the patients can get the care they need and get the results. And that will get you healthier patients and a better reputation.
Thanks for joining us today. We've got a training boot camp coming up in Atlanta on January 28th through the 31st. If you'd like more training just like this, or you just want to check out ways AMC can help your practice, contact us for a free guest pass today.